Today, we're talking about one of the most serious and most misunderstood cancers that affects older adults: pancreatic cancer. Now, I know that phrase alone can feel scary, but here's what I want you to understand before we go any further. Knowledge is not something to fear. Knowledge is the single most powerful tool you have. And the reason I'm making this video is simple. Pancreatic cancer is often called a silent disease because its early symptoms are so subtle, so ordinary seeming that most people brush them off for weeks or months before ever seeing a doctor. Here's a number that should stop all of us in our tracks. Roughly 80% of pancreatic cancer cases are diagnosed at an advanced stage. 80%. Not because medicine failed, not because there weren't signs, but because the signs look like everyday complaints: a little back pain, some bloating, fatigue that just wouldn't quit. Things that, frankly, a lot of us over 60 experience and chalk up to getting older. But what if you could recognize those quiet signals early, when treatment options are wider and outcomes are dramatically better? That's exactly what we're going to do right now. I'm going to walk you through 8 early symptoms of pancreatic cancer that too many people ignore. I'll explain each one in plain, clear language, no confusing medical talk, I promise. And I'll tell you what makes each symptom different from the ordinary aches and pains of daily life. Some of these will surprise you. 1 or 2 might even sound familiar. So stay with me all the way to the end, because number 6 is the one that catches almost everybody off guard. Let's begin. Number 1, jaundice, a yellowing of the skin or the whites of your eyes. Let's start with one of the more visible signs, even though many people still miss it or misunderstand it. Jaundice is when your skin, and especially the white part of your eyes, takes on a yellowish tint. Sometimes it's very faint, almost like a warm, golden hue that you might not notice unless you're standing in good natural light. So why does this happen with pancreatic cancer? Your pancreas sits deep inside your abdomen, tucked right behind your stomach, very close to your bile duct. Think of the bile duct as a tiny highway that carries a fluid called bile from your liver down into your intestines. Bile helps you digest fats, and it's what gives your stool its normal brown color. Now, if a tumor starts growing in the head of the pancreas, that's the wider end, closest to the small intestine, it can press against that bile duct like a fist squeezing a garden hose. The bile backs up. It seeps into your bloodstream, and that backup turns your skin and eyes yellow. Here's what makes this tricky. A lot of folks see a little yellowing and think it's related to something they ate, or maybe a medication side effect. And yes, other conditions can cause jaundice, gallstones, hepatitis, even certain antibiotics. But jaundice that appears gradually, without obvious explanation, especially after age 60, deserves a phone call to your doctor. Not next month, not after the holidays, soon. You might also notice 2 companion symptoms alongside the yellowing. Your urine may turn noticeably darker. Think the color of strong iced tea or even cola. And your stools might become unusually pale, almost clay-colored or chalky. That pale color happens because the bile isn't reaching your intestines anymore. Those 3 together, yellow skin, dark urine, light stool, are a combination you should never write off as normal aging. Number 2, unexplained weight loss. Now, a lot of us wouldn't mind losing a few pounds, right? But there's a big difference between dropping weight because you started walking every morning and dropping weight when nothing in your routine has changed. Unexplained weight loss means you're shedding pounds, sometimes 10, 15, even 20 pounds over a couple of months, without dieting, without exercising more, without trying at all. Your clothes feel looser. Your face looks thinner. Maybe your neighbor or your grandchild comments that you look like you've lost weight. And your honest answer is, I don't know why. With pancreatic cancer, this happens for a couple of reasons. First, the tumor can interfere with how your body produces digestive enzymes. Your pancreas normally makes enzymes that break down the food you eat so your body can absorb nutrients. When the pancreas isn't working properly, food passes through you without being fully digested. You're eating, but your body isn't getting what it needs. Second, cancer itself burns through energy. Tumor cells are greedy. They consume calories and redirect your body's resources toward fueling their own growth. Many seniors ignore this sign because they assume their appetite just naturally decreases with age. And yes, appetite can shift as we get older, but steady, unintentional weight loss, especially more than 5% of your body weight in 6 months without a clear reason, should always prompt a conversation with your healthcare provider. Ask yourself honestly, have I lost weight recently without meaning to? If the answer is yes, please don't brush it aside. Number 3, persistent abdominal or back pain. This is the one so many people mistake for something else entirely. Muscle strain, arthritis flaring up, sleeping in a funny position, even kidney trouble. Pain from pancreatic cancer tends to show up in the upper abdomen, the area right below your breastbone and sometimes slightly to the left. But here's the part people don't expect. It frequently radiates to the middle or lower back. Some patients describe it as a deep, gnawing ache. Others say it feels like a dull pressure that just won't let up, almost like someone is pressing a fist into their spine from the inside. What sets this pain apart from ordinary back trouble? A few things. It often gets worse after eating. It may feel worse when you lie flat on your back and slightly better when you lean forward. And unlike a pulled muscle that improves with rest over a week or two, this pain sticks around. It doesn't respond the way you'd expect to over-the-counter painkillers. It's persistent, it's stubborn, and it gradually worsens. Because the pancreas is located so deep in the body, nestled against the spine and surrounded by other organs, a growing tumor can press directly on the network of nerves behind it. That nerve pressure is what creates that radiating back pain so many patients describe. If you've had abdominal or back pain that has lasted more than 2 or 3 weeks and doesn't have an obvious explanation, bring it up with your doctor. Write it down before your appointment so you don't forget. Describe when it started, where exactly it hurts, and what makes it better or worse. Number 4, new-onset diabetes, especially after age 55. This one is fascinating and critically important. If you've recently been diagnosed with type 2 diabetes, particularly if you're over 55, you're at a healthy weight, and you don't have a strong family history of diabetes, your doctor should be considering the pancreas very carefully. Here's the connection. Your pancreas has 2 big jobs. One is making digestive enzymes, which we already talked about. The other is producing insulin. That's the hormone that controls your blood sugar. When a tumor disrupts the insulin-producing cells in the pancreas, your blood sugar starts climbing. You get diagnosed with diabetes, and everybody assumes it's just the garden variety kind that millions of Americans develop. But researchers have discovered something striking. In a significant number of pancreatic cancer cases, a new diabetes diagnosis showed up within 1 to 3 years before the cancer was found. The diabetes was, in a sense, the very first alarm bell, ringing clearly, and almost nobody recognized it for what it was. This doesn't mean that every new diabetes diagnosis is cancer. Far from it. The vast majority of diabetes cases have nothing to do with pancreatic cancer. But if you're a senior who was recently told you have diabetes and the diagnosis surprised you, maybe your doctor said your blood work was completely normal just a year ago, please mention it. Ask whether further imaging of the pancreas might be a reasonable step. Now, before we move to symptom number 5, I want to pause for just a moment and say something directly to you. If you're over 60, or if you're watching this because you care for an elderly parent, spouse, or grandparent, this information could genuinely be life-saving. Early detection changes everything with this disease. So if anything we've discussed so far sounds even a little familiar, please don't wait. And if this video is helping you, hit that subscribe button right now so you never miss a senior health. We put out new videos regularly, and every one of them is made with you in mind. All right, let's keep going. Number 5, digestive problems, nausea, bloating, and feeling full too quickly. Picture this. You sit down to a meal you've enjoyed your whole life, pot roast and vegetables maybe, or your daughter's chicken soup. You take a few bites and suddenly your stomach feels heavy, stuffed, almost swollen, like you've eaten Thanksgiving dinner when you've barely touched your plate. Maybe a wave of nausea rolls through you. Maybe you push the plate away and say, "I'm just not hungry today." One day of that is nothing. A week of it during flu season makes sense. But when this pattern stretches on, weeks of bloating, nausea that comes and goes without clear cause, a feeling of fullness after just a few bites, your body may be telling you that something is interfering with normal digestion. A pancreatic tumor can physically press against the stomach or the upper section of the small intestine, partially blocking the flow of food. It can also starve your digestive tract of the enzymes it needs. Without those enzymes, fats especially don't break down the way they should. You might notice your stools become oily, greasy, or unusually foul-smelling. They might float in the toilet bowl when they didn't before. That's a sign called steatorrhea, fatty stool, and it happens because undigested fat is passing straight through you. Many seniors chalk these symptoms up to a sensitive stomach or acid reflux, and most of the time, that's all it is. But persistent digestive disturbances that don't improve with dietary changes or standard medications deserve a closer look. Number 6, and this is the one I said might catch you off guard: blood clots. Yes, blood clots. Specifically, a condition called deep vein thrombosis, where a clot forms in a deep vein, usually in the leg. Your calf might swell. It might feel warm to the touch, tender, maybe reddish or purplish. Sometimes the clot breaks loose and travels to the lungs. That's a pulmonary embolism, and it's a medical emergency. Now, you might be wondering, what on earth do blood clots have to do with the pancreas? More than most people realize. Pancreatic cancer releases certain substances into the bloodstream that make your blood stickier and more prone to clotting. Doctors have known about this connection for years, and sometimes an unexplained blood clot is actually the very first sign that a hidden cancer is growing. This is especially relevant for seniors because blood clot risk already increases with age, reduced mobility, and other health conditions. If you develop a blood clot and your doctor can't pin down a clear cause, no recent surgery, no long flight, no obvious injury, ask whether screening for an underlying condition, including cancer, might be appropriate. This symptom blindsides people because it seems so completely unrelated. A clot in your leg and cancer in your pancreas, they don't seem like they belong in the same conversation. But your body is one deeply interconnected system, and sometimes the warning shows up in the last place you'd ever think to look. Number 7, extreme fatigue that doesn't improve with rest. We all get tired. After a long day with the grandchildren, after yard work, after a poor night's sleep, tiredness makes perfect sense. But the fatigue associated with pancreatic cancer is different. It's a bone-deep exhaustion that doesn't lift after a full night of sleep. You wake up feeling like you never went to bed. Simple tasks, making breakfast, walking to the mailbox, folding laundry, feel like they require twice the effort they used to. This kind of fatigue happens because the cancer is disrupting your metabolism. Your body isn't absorbing nutrients efficiently. Inflammation is running in the background like a program draining your phone's battery. And your immune system is working overtime trying to fight something it can't quite get ahead of. What makes this so easy to dismiss is that fatigue overlaps with dozens of common conditions in seniors: anemia, thyroid problems, depression, medication side effects. On its own, fatigue isn't enough to point to pancreatic cancer. But when it shows up alongside other symptoms on this list, unexplained weight loss, digestive changes, that lingering back pain, the pattern starts telling a story that your doctor needs to hear. Keep a simple journal if you can. Write down your energy levels each day for a couple of weeks. Note what you ate, how you slept, how you felt by afternoon. That kind of record gives your healthcare provider something concrete to work with instead of a vague, "I've been tired lately." Number 8, depression or anxiety that appears suddenly and without a clear trigger. This final symptom is perhaps the most overlooked of all, and it breaks my heart a little because it gets dismissed so easily. Research has shown that sudden onset depression or anxiety can sometimes precede a pancreatic cancer diagnosis by months, even before any physical symptoms appear. Scientists aren't entirely sure why, but the leading theory involves the biochemical signals that pancreatic tumors release. These substances may directly affect brain chemistry, altering mood and emotional regulation before the tumor is large enough to cause pain or digestive trouble. Patients describe a sudden, heavy darkness settling over them, not triggered by grief, not tied to a life event, not seasonal, just an inexplicable shift in how the world feels. For seniors, this is especially dangerous territory. Doctors and family members too often attribute mood changes in older adults to loneliness, retirement adjustment, or simply getting older. And while those are real factors, a dramatic and unexplained shift in mood, particularly in someone who has been emotionally stable for most of their life, warrants a thorough medical evaluation, not just a prescription for antidepressants. If you or someone you love has experienced a sudden personality shift, withdrawal from activities they used to enjoy, pervasive feelings of dread, unexplained crying spells, please consider the possibility that something physical could be driving it. The mind and body are not separate. They are constantly speaking to each other, and sometimes the mind sounds the alarm first. So, what can you actually do with all of this information? Let me give you some practical steps. First, know your risk factors. Your risk, even if you quit years ago. A family history of pancreatic cancer matters. Chronic pancreatitis, long-term inflammation of the pancreas, raises risk as well. Obesity and heavy alcohol use also play a role. Second, don't diagnose yourself, but do advocate for yourself. Having one or even two of these symptoms does not mean you have pancreatic cancer, but it does mean you should talk to your doctor. Print out this list if it helps. Show it to your physician and say, "I've been experiencing these things, and I'd like to rule out anything serious." You are not being dramatic. You are being responsible. Third, ask about imaging if you have multiple symptoms. A CT scan or an MRI of the abdomen can give doctors a detailed look at the pancreas. An endoscopic ultrasound is another powerful tool that gets even closer to the organ. These aren't routine screening tests for the general population. There's no standard pancreatic cancer screening the way there is for colon or breast cancer, but if your symptoms and risk factors align, your doctor can absolutely order them. Fourth, take care of the body you have today. Stop smoking if you still do. Your doctor can help with that. Maintain a healthy weight through balanced eating and gentle activity. Limit processed meats and sugary beverages. Eat more fruits, vegetables, and whole grains. Stay hydrated. These steps won't guarantee protection, but they measurably lower your risk. Fifth, and this one's for families, pay attention. Sometimes the person experiencing symptoms won't speak up. Maybe they don't want to worry anyone. Maybe they're afraid of what they'll hear. Be the one who notices. Be the one who gently says, "You haven't seemed like yourself lately. Can we get that checked out?" That conversation could change everything. Let's bring it all together. The 8 early symptoms of pancreatic cancer that you should never ignore are: 1. Jaundice, yellowing of the skin or eyes, often with dark urine and pale stools. 2. Unexplained weight loss that happens without any change in diet or activity. 3. Persistent pain in the upper abdomen or mid-back, especially pain that worsens after eating or when lying flat. 4. A new diabetes diagnosis that arrives unexpectedly, particularly after age 55. 5. Ongoing digestive problems including bloating, nausea, early fullness, and greasy stools. 6. Unexplained blood clots, especially deep vein thrombosis without an obvious cause. 7. Crushing fatigue that doesn't respond to rest or sleep. 8. Sudden depression or anxiety with no clear emotional trigger. No single symptom on this list is proof of cancer, but together, in combination, they paint a picture. And recognizing that picture early could be the difference between a diagnosis that offers options and one that takes them away. I need you to hear this clearly. Your health matters. Your instincts matter. That quiet voice inside you that says something doesn't feel right. That voice matters. Don't silence it to be polite. Don't ignore it because you don't want to bother anyone. You spent decades taking care of other people, raising children, building careers, supporting families. Now it's time to take care of you with that same devotion and seriousness. You deserve doctors who listen, you deserve answers, and you deserve to walk into every appointment knowing that asking questions is not weakness. It's wisdom earned through a lifetime of experience. If this video helped you understand something you didn't before, I'm asking you to do 3 things. First, subscribe to this channel and tap that notification bell. We create senior health content every week, and I want to make sure you never miss a video that could matter to you or your family. Second, share this video. Send it to your spouse, your siblings, your adult children, your friends at church or at the community center. You never know who needs to hear this today. And third, drop a comment below. Tell me, did any of these symptoms sound familiar to you? Have you or a loved one experienced something on this list? Your story might be the one that convinces someone else to make that doctor's appointment. Thank you for trusting me with your time. Take care of yourselves and each other.